Basal joint osteoarthritis, or arthritis of what's called the CMC joint, is a common cause of thumb, hand, and wrist pain. In this video, I'll discuss risk factors for developing it, especially if you're in the military, as well as signs, symptoms, and treatments for this complicated problem. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. The carpometacarpal, or CMC joint, also called the basal joint, is a saddle-shaped joint of the thumb, and it has extensive range of motion because it's not really confined in a bony arrangement. The thumb CMC joint has been shown to have up to 13 times the force transmitted through it from the tip of the thumb. And the anatomy of that joint, the force transmitted through it, makes it extremely susceptible to osteoarthritis. It's the most painful joint when you compare it to osteoarthritis of any other joint in the hand. And so it's probably no surprise then that osteoarthritis of that basal joint or the CMC joint, it's a very common complaint. Hand surgeons see it all the time, has a significantly negative effect, not just on your work as you might expect, but also in terms of life satisfaction. It's the second most common site of osteoarthritis in the hand after the distal interphalangeal joint. Risk factors for this basal joint osteoarthritis: females get it far more than males, middle age, and inflammatory joint disease, but also previous trauma and repetitive use to the hands over a long period of time have shown to be causative factors in the development of CMC joint arthritis. That's why you see it very often in military veterans. Patients with basal joint arthritis or CMC joint arthritis complain of pain at the base of the thumb, usually worse when you're doing tasks that involve using your hands, things like opening a jar or turning a doorknob. Now, non-surgical treatment options are the way to go at first. There are braces for it, there's activity modifications, even steroid injections into that joint can be short-term fixes, can get rid of symptoms, can get rid of pain in symptomatic people. But as it gets to be more advanced arthritis, or people just aren't getting better with non-surgical treatment, that's where you talk about surgery. And that can be ligament reconstruction, that can be fusion of that joint. There's a number of different treatment options that exist and can have good outcomes. It's a relatively straightforward surgery, but it is a long recovery. But again, for purposes of this video and for this channel, it is important to know that repetitive use over time with the hands can increase your risk for developing, again, that basal joint arthritis right at the base of the thumb, causing thumb, hand, and wrist pain. All right, if you have ideas for topics for future videos for this channel, injuries, risk factors for injuries like we talked about here, or anything else, leave those in the comments below. Make sure to subscribe to this YouTube channel, click the bell to be notified when I release a new video. If you're interested in a Nexus letter, whether that's basal joint arthritis or any other hand or wrist or really any other problem or medical condition, you can click the link in the description below this video to learn more about working with me. I do everything I can to make the process as simple and as quick as I can for you, and I really try to write a Nexus letter that gives you the best chance of success in your disability claim. Thanks for watching, and I look forward to working with you more.